there's just so much.
You're listening to a Mamma Mia podcast.
You feel more and more invisible the older you get if you are a little bit overweight, because you've been essentially slightly invisible for your whole life because you're told you're not thin enough to be visible. And it takes a real toll on your mental health over time, and it's hard not to hate yourself because it's like, why can't I do what everyone else does? Hello, welcome to Well, your full body health check. I'm Claire Murphy.
And I'm Dr. Mariam.
And together today we are going to jump in and find out what exercise is best to drop your risk of chronic disease down the line. So like, do star jumps help reduce your risk of osteoporosis, or does cardio help you avoid diabetes? We will get to the bottom of it. Also, Mariam, today, I nearly cried when I read Carolyn's quick consult. She's really struggling with weight and is completely stressed out about it, despite doing a lot to try and keep it in check for herself. And when I tell you the PTSD I felt when reading her quick consult today, I totally get you, Carolyn. So hopefully we'll see what Dr. Mariam can help you with to try and get on top of that. But first, we're being told that when we go in for certain types of surgery, we possibly might want to ask our doctor to whip out some other bits while they're there. We'll tell you why. Because it is time to go to med school.
Welcome to med school.
So, Mariam, I saw this post from the Royal Women's Hospital in Melbourne last week, quoting Professor Orla McNally, who's the Director of Gynecological Oncology. They describe how women should be given the option to have their fallopian tubes removed during other routine surgery. So not just surgery that you're having in that region for fallopian tube purposes.
Yep.
Professor McNally says if you're having abdominal surgery, ask whether your fallopian tubes can be removed at the same time, because most ovarian cancers actually start there and not in the ovaries themselves. She said the idea is that it could be key to helping prevent and detect ovarian cancers a lot earlier than we currently have the ability to do. And as we know, having spoken about ovarian cancers a little while ago, that the reason why the survival rate for ovarian cancer is low is because it gets caught very far down the track. What do you think about that, Mariam? And how do you then have that conversation with patients, or tell patients how to have that conversation with their surgeon?
So Prof is absolutely right. So by safely removing the tubes when there's already a reason to be in the abdomen, we may be able to reduce the risk of ovarian cancer later on. And this approach is especially recommended for anyone who's already having pelvic or abdominal surgery, women who have finished having children, and those considering permanent contraception as well. The Women's Hospital is actually at the forefront of making this routine practice here in Australia, and they're leading research into how women and surgeon feel about it, which is fantastic. So what does it mean in practical terms? So if you fit the criteria we mentioned and you're having a lower abdominal surgery, say for instance a hysterectomy, a tubal ligation, or even sometimes a C-section, it's worth asking your surgeon, hey, I've heard about removing the fallopian tubes and it can potentially lower my risk of ovarian cancer. Is that something that could potentially be right for me? Just have that conversation with your surgeon. Just to be clear, this isn't something everyone should go out and request separately. It's a preventative option to consider if you're already having surgery. And for women at higher genetic risk, like for instance those with a BRCA mutation or a strong family history of ovarian cancer, more specific risk-reducing surgery might be discussed with a specialist. It's not right for everyone, but it's definitely an important conversation to have, especially if you're already going under the knife for another reason. And as someone who works in women's health, I love seeing this kind of preventative approach being normalised. Yeah.
Can I ask you something, though? I know a few people who work directly with surgeons.
Yep.
And I'm not going to tar everyone with the same brush because I know people are different. But surgeons are very smart people who are very trained and sometimes feel like they know best. And so if you go in there asking for something that they haven't sort of got on their radar, they might not be too open to it.
And no, that's completely true, because when I shared the post, I actually had a few females saying, oh, hey, I actually suggested this and the surgeon turned me down. So in that instance, I would say, is it something you can do? Why can't you do it? And really kind of advocate for yourself. And if you're not happy, then seek a second opinion from another surgeon who could potentially can. Unfortunately, there are dicks in every industry.
Yeah.
And that includes surgery.
Okay. So find yourself a non-dickish surgeon and try again.
Yeah.
All right. Checkup time. What exercise should we be doing to best avoid chronic disease?
It's time for the checkup.
Confession time.
Yep.
There was a point in my life a few years ago when my GP said to me, "You are pre-diabetic." At the time, I did not know what that meant, but it meant that my blood sugar levels were creeping perilously close to a level that would make me a type 2 diabetic. Exercise has always been a bit of a nemesis for me. And so, I mean, it ties in with the fact that I did my cruciate ligament when I was a teenager. And so I've never had a really stable knee joint. And so a lot of exercise. And that includes running, walking, squats, yoga, like everything that a knee joint is included in, I couldn't really do. And if I did try it, it would end up being very painful and it would, blow up and fill up with fluid. And it was just, and I used it, I think, as a bit of an excuse too to not exercise because I'd be like, I've got a bad knee, so I can't do it. So it was a psychological thing as well as an actual physical thing. So I had a knee replacement a couple of years ago and it definitely changed my life quite a bit. So I was no longer in pain, which I had been for a very long time. But it was more because of the doctors I, at that point, then had in my corner who all worked together to help me. So my GP was part of that. I also had a dietitian. Leonie, my physio, oh my God, who is now also basically my therapist because she specialises in chronic pain. This is another thing I didn't realise either. You tell me all the time about GPs having specialties. Physios also have specialties.
That's right, yep.
So my physio specialises in chronic pain, and so she was able to kind of coach me through all of that.
It's women health physios.
Oh my God, yeah. So much great knowledge out there in communities. You just got to find the right one. She ended up teaching me quite a bit about myself, to be honest, including the psychological aspect of that. It took all of their help together combined to help me reverse my slide towards type 2 diabetes. And so it does take a village sometimes. So if you're sitting there by yourself thinking, I am overweight or I'm unhealthy or whatever your situation might be, and you are also in that pre-diabetic window and you are struggling to get on top of it, I completely understand. It's really hard to do it by yourself. And it took 4 or 5 people with me working together to actually get me to a point where I was able to reverse that. And exercise is part of that equation. Mariam, how do you help people start down that track to getting their health in check when you do start seeing the signs of those chronic illnesses creeping in?
Yeah. So what you've described is something I see so often in clinic. And the truth is when someone hears that word pre-diabetic, it can feel like a bit of a punch in the gut because it's not just a medical label. For many, it's like kind of a wake-up call and it can stir up fear, guilt for some people and frustration and sometimes even shame.
There was definitely the, oh my God, that doesn't happen to people like me vibe.
Exactly.
Yeah.
But what I love about your story is it highlights something really important. You didn't do it alone. You had a team around you. You had your GP, whether it's dietitian, you had a physio, and that's exactly when things start to turn around. So chronic health issues like pre-diabetes, osteoarthritis, or weight struggles aren't just about willpower. They're about systems of support, small steps, and understanding your body's story. And when I see those early signs, so they're not hypertensive, but the blood pressure's starting to rise, weight is starting to creep in. I try to start with curiosity and not criticism. So we talk about what's really going on in their life. Are you sleeping well? Are you stressed? Are you in pain? Because you can't fix what you can't understand, right? And you can't heal in isolation. So we start small. Maybe it's a 5-minute walk after dinner. Maybe it's swapping one sugary drink for water. Maybe it's connecting them with a physiotherapist who gets chronic pain or a dietitian who can make food feel joyful again. And it's about momentum, not perfection. And I think your story is a perfect example of that. When the right people come together and when the focus shifts from punishment to partnership, then that's when we start to see the real change. Yeah.
It was my dietitian who taught me that my relationship with food was a little bit dysfunctional.
Yeah.
And she said to me, you're working in this cycle of punishment and reward.
Yeah.
So I would punish myself if I ate anything that I considered unhealthy. And so then I would not eat, and then I would reward myself with like a sweet treat for not eating.
Yeah.
And she was like, that's not going to get you anywhere.
Yeah.
Like, so she really opened my eyes. But the thing I still struggle with, and we talked about exercise, Mariam and I joke a bit about sucking at it and not being able to get it into our lives as well as we probably should. We do have a lot of things that are made available to us to make it easier, but how do we get past the call of the couch? It's the motivation that is hard.
Look, we joke about it because it's something everyone, I think, struggles with. And even those of us who know how good exercise is for us.
Like we know it. Yeah. It's not that we don't know it.
We can find it hard to actually do. So from a GP's perspective, motivation isn't really just all willpower. It's about connection. So research shows that people are far more likely to move their bodies if that activity feels meaningful, if there's like a social connection or it's bringing you joy. So instead of thinking, I need to exercise, I often encourage people to ask, what kind of movement actually makes me feel good physically and mentally? For some, that's walking with a friend and having a chat. For others, it's dancing in the kitchen, gardening, playing with your dog. The key is to lower the barrier to entry and make it easy so that the body doesn't feel silly for doing it, right? So 5 minutes counts for me, 10 minutes counts for me. The body doesn't care if it's a gym session or a walk to the shops. It just loves to move. So then there's the mindset piece, and I find this the hard one. So we often wait for motivation to show up before we start, but motivation, I feel, comes after we start, right?
That's the tough part, right? Because we're sitting on the couch, we're like, okay, motivation, come at me. And you're like, if you actually get up and start moving, the motivation comes with that,
That's right. So once you move, even just for a little, your brain releases those feel-good hormones, and that's what keeps you coming back. So if the couch is calling, maybe start by saying, I'll just do 5 minutes to start with. Put on a song, stretch, walk around the block. Chances are once you start, you'll keep going. And if you don't, that's okay too. The win is just showing up for yourself, even if it's in a small way. Yeah.
Here's one weird little tip I have for those of you who work from home. So in the mornings when I get dressed, I found that if I wear from the bottom half down formal, I will not exercise that day.
Yep.
If I put on a pair of like bike shorts or trackies, depending on the weather, but the top half is corporate, right? I can still do my Zoom calls, but if at least half of me is ready and prepared for exercise in the day, I am more likely to do it.
There you go.
So like sometimes it's just whatever you put on.
Yeah.
So weird tip. There you go. See if it helps. On the way, Carolyn has an issue with her weight that is making her feel absolutely desperate, and we're going to try and get some help for you, Caroline. But next, Professor Jeff Coombes will help us figure out which exercise is good for preventing chronic disease and what might help us if we're dealing with those issues too.
A strapless bra that stays put or wire-free support that actually supports. That is Nala. They do the inclusive sizing A to J, wire-free support and straps that stay put past 3 p.m. Right now, Mamamia subscribers have 25% off site-wide. We call it the subscription that pays for itself because realistically, one Nala shop, and I do shop at Nala very often, it covers the cost of your membership for months. If you are already a subscriber, the code is in your subscriber hub. And if not, join via the link in the show notes and you can unlock it instantly. Support women's media while Nala supports you.
Jeff Coombes is a professor in the School of Human Movement Studies at the University of Queensland. We started off our chat with Jeff asking about whether cardio is king when it comes to exercise for heart health. Now, Jeff, we are going to be talking about a lot of chronic diseases today and the potential exercise regimes we can put in place to either limit the risk of progressing to a chronic disease, or if you have that disease already, what we can potentially do to help deal with that. So we're going to start off with one of the issues that kills a lot of Aussies every year, and that is heart disease. And we've been told over many decades that cardio is the thing that gets your heart pumping, and that's the thing that's going to help us with heart disease. Does that still stand?
If you're trying to prevent heart disease, then yes, cardio exercise, aerobic-based exercise would be your number one choice. You really can't do cardio alone these days. Whatever age you are, you need to add resistance training in. But with limited time, and if heart disease is the thing that you want to try and protect against, then cardio is going to be the best.
Okay, so what do we mean when we say cardio?
Yeah, so exercise of different modes. So most common mode is walking, running, cycling, swimming, really anything that gets the heart rate up. And if we look at the important aspect in that is intensity. So People going for a walk need to get the most out of their exercise, need to do it at a higher intensity. So we rate intensities as low, moderate, high. So if you're going for a walk at low intensity, then that's great. If you're going for a walk at moderate intensity, that's better. And if you're going for a walk at high intensity or able to do something like interval training at a high intensity, that's even better still.
Can you explain interval training to us and how someone who is not a professional athlete might be able to incorporate that into their sort of day-to-day exercise routine?
Yeah, sure. It's something that we really try and promote more and more because we know the benefits of interval training. So it's really doing something at a higher intensity, and I pick the word higher on purpose, not just high. So you do something at a higher intensity and then you have a rest or a slow recovery and then you do it again. So that's the interval: higher intensity, lower intensity, higher intensity, lower intensity. So a typical prescription for people that aren't used to exercising is to use, if they're out on the street, to use telegraph poles and walk between two telegraph poles at a higher intensity than what they usually would, and then walk the next one at a lower intensity and do that again. So that's a good, easy to use example of interval training.
If you live in South Australia, Jeff means Stobie poles. Same thing. All right, moving on. Can the right type of exercise actually lower your risk of certain chronic diseases? So say things like type 2 diabetes or osteoporosis, is there exercise that can reduce our risk of progressing to those?
Most definitely. And now with the amount of evidence that's out there, you often hear sayings like if exercise was a pill, you'd prescribe it to everyone to have the best chance of preventing disease. So across nearly every chronic disease, exercise has been shown in large trials, cohort studies, to be very protective.
If we were to pick an exercise that would reduce our risk significantly, but without it being something insane like CrossFit, for example, if we're going from one extreme to another, we get told to walk all the time. Is walking really the thing that we should focus on first before we expand out into other forms of exercise?
As always, it depends. So if you're someone that's over the age of 50 talking to me, I'd certainly say resistance training needs to be on the same footing with aerobic training to build, especially if it's a female, to build up resistance against the bone-related conditions that we know happens in women more. So it depends. If it's someone, let's say, below 50, generally aerobic exercise is what you're going to preferentialise. In terms of across the whole spectrum, if you only have a short period of time during the week, then a combination of the two. So your typical circuit training where you might do a bit of aerobic and then do some strength exercises and then some more aerobic. And again, I want to highlight you don't need to go to a gym to do that. You can do that out on the street. You can power walk for a telegraph pole and then stop and do some squats and then power walk again. So mightn't look the greatest, but you don't need necessarily equipment or to go pay money to do the type of exercise that would be most beneficial to you.
Can you give us an idea on what resistance training, I mean, you've just mentioned squats there, but what other things can we do to deal with things like a loss of bone density?
Yeah, so other exercises, I mean, there's some other therapies that can be brought in. Loss of bone density is, if you're prioritising again, resistance strength training, types of exercises. My go-to first exercise that I like to talk to people about, whether they can do it, is a squat. So even if it's just something as simple as getting up and down out of a chair 10 times, can you do that? Can you put your hands on your shoulders, make it a little bit more difficult? Can you hold a milk container against your chest when you do it? Squats, if people have the musculoskeletal health to do it, is the number one exercise. For an upper body exercise, people can get down on the ground to do knee push-ups. If they can't, a bench push-up. If they can't do that, a wall push-up. So there's two exercises that are going to hit a lot of major muscle groups in upper body and lower body. And then you can, again, flow on from that. If a person can do lunges is another good lower body exercise. People can do tricep dips on their chair or bench. So you can keep building exercises up that use your body weight and maybe some weights around the house to get that resistance.
I've been seeing quite a few videos in my timeline actually of people saying that squats are really important for not just bone density, but as we age, we know that a lot of elderly people who want to stay in their own homes sometimes come unstuck when they can't get up off the toilet or can't get out of a chair and end up falling. So that is really helping to almost age-proof yourself against certain things too, right?
Perfect, yeah. And again, that's one of our major messages. And trying to give people advice is when they could do the squat, for example, for a female if they're going to the toilet or a male if they're going to the toilet. Once they're finished, try and do 5 or more squats just up and down off the toilet. There you go. You get some exercise in each time you go to the toilet, which could be helpful. So, yeah, I think squats should be the number one exercise if people have the muscular health to do it. And again, people may not, hip, knee problems, they mightn't be able to do it. So that's where you might have to modify it a little bit.
Well, Jeff, how do we protect our joints in this process? Because especially as we age, they tend to get a little creaky and maybe don't work as well as they used to. And for some people, like myself, for example, I had an injury many years ago, which means one knee joint has not been good. I've had a knee replacement now, so we're titanium good. But for a lot of people, joint injuries can be a long-lasting issue too. So how do you make sure you're doing things that won't put joints at risk?
Yeah, again, it depends on what you can find that doesn't flare the joint up, that doesn't cause pain to a level where you don't want to keep exercising. And if people do have joint problems, often getting the weight off the joint, so cycling, swimming, using some of the new resistance type equipment, aerobic equipment, like a new step or a step walker. But everything isn't going to work for everyone. You usually find something that doesn't flare the joint up, that feels like it's giving that same aerobic workout, that you're getting your heart rate up. Yeah, but it's often difficult to... I was talking to someone one-on-one. It's a 10-minute conversation, trying to find out what you've tried, what's worked for you, what you like, what you don't like.
That's the thing too, is exercise is so relative to the person, isn't it? Because we are all... we like what we like, and a lot of us just dislike exercise in general. So it could be a hard thing to kind of tailor for any group of people, right? But in that instance, if you're struggling to figure out alternatives, is that a good time to maybe reach out to your GP to get some idea of alternatives, or they can maybe refer you to people who might be able to help you make choices that are best for what suits your physical condition as well as what might be helpful for you health-wise?
Yeah, definitely. I think staying in the conversation with your GP is really a smart place to go, because the GP is going to hopefully know enough about your medical history to give you really good advice. And we're very lucky in Australia too that if you have a chronic condition, Medicare does cover visits to an exercise physiologist. So if you do have a chronic condition and you go and see your GP and you do bring up exercise with them, it could be that they'll put you on a management plan that allows you to go and see an exercise physiologist and maybe some other allied health professionals. You mentioned about the joint problems, often working with a physio to understand how the exercise can be tailored for their specific musculoskeletal condition is really beneficial. And those visits with the exercise physiologist, it's not your typical personal training that you might think of. It's sitting down and trying to work through, what does exercise mean to you? Claire, why do you exercise? And then try to get the person to keep reflecting back. When they're having those struggles with exercise, perhaps reflect back on why it is you want to exercise. So, yeah, GP, perhaps referral to an exercise physiologist can be quite useful for sustaining exercise habits.
Maybe a psychologist thrown in for good measure to figure out why we're so adverse to doing exercise, perhaps. Just finally, I would like to know whether we can reduce our risk for things like high cholesterol or high blood pressure through exercise. What sort of things should we be doing if every time we get a blood test we want to keep those things in the normal range? How do we do that?
Yeah, so the blood pressure especially is number one risk factor for heart disease, so it's really important to keep that under control. Exercise will lower blood pressure about similar to what one medication will do. However, people that have high blood pressure will know that often one medication isn't enough, and the doctor will continue to add more on to get that blood pressure down to target. So exercise will help, but it's not necessarily, if you've got high blood pressure, it's not necessarily going to be as powerful as medications to bring it down, but it will certainly help. Same with cholesterol. exercise improves the good cholesterol, the HDL cholesterol. But again, if you've got high LDL cholesterol, exercise doesn't do too much for lowering that. It'll lower it a little bit, but you really are relying on medications to get it down. And then the exercise has so many other benefits to other cardiovascular risk factors, especially vascular health. We're very interested in it. We've learned a lot about how exercise improves our arteries, our arterial function, how that works for brain health and blood flow to the brain. And certainly, in addition to those risk factors that you mentioned, exercise can benefit heart health in a lot of other ways.
So first question for you, Jeff, from our Well community is, I had a blood test recently and was told I'm pre-diabetic. I know I need to change what I eat, but what should I focus on exercise-wise now that this is an issue? How do I not become type 2?
Yeah, well, out of all the chronic conditions, if I was to pick one that exercise has the most benefit for, it would be diabetes prevention, and especially for people that are in this pre-diabetes stage. So I'd say it's one of the main reasons why exercise physiologists exist in Medicare is because of the powerful evidence that exercise can stop the progression to full type 2 diabetes. In fact, the research that were conducted that gave us that evidence showed that exercise was actually more powerful than the number one drug that's prescribed for people with type 2 pre-diabetes. To answer the question, yes, definitely do exercise. What type of exercise? I always say that the type of exercise that you're going to do. So I can tell you the most beneficial exercise is doing a combination of high-intensity interval training and high-intensity resistance training. But if that doesn't suit you, then do what you enjoy doing. Then progressing that on how much should I do? If you can do 3 high-intensity interval training aerobic sessions a week and 2 high-intensity resistance training sessions a week, so that's exercising for 5 days a week, that is going to be the best exercise to stop progression. And I can guarantee if they do that, they won't, and you'll do it for maybe 2 to 3 months, they'll see their numbers drop even without weight loss.
I don't know about the person who asked that question, but hearing the words high intensity is sometimes terrifying. I mean, what does that mean, high intensity?
Yeah, so probably easiest way to talk about it is using something called the talk-sing test. So if it gets to a point where you can't really talk without taking a breath, then you're in the high intensity zone. So there's better ways of monitoring it. Heart rate above 80% of age-predicted heart rate max is if you were going to a trainer, that's what they'd be looking at. Nowadays, with the advent of wrist-worn heart rate monitors, it is quite easy if you're technically minded to look at your heart rate during exercise and get an understanding of where you might need to go to get into that high-intensity zone during your high-intensity intervals.
Our next question for you is, what is the healthiest form of exercise? Like something that I won't hurt myself doing, but will actually help me be healthier and fitter and avoid things like osteoporosis.
Certainly, when I hear don't hurt myself, it is about making sure that resistance training is where I'm going straight away with osteoporosis. So mine goes for resistance training. Avoiding hurting yourself. I think that's with the quality of your movements. And again, going to professionals, going to personal trainers, exercise scientists, exercise physiologists is going to help making sure that the movements are done in a way that you'll decrease your risk of hurting yourself. However, again, my knowledge over the years is that a lot of the population, probably the majority of the population, either don't have the resources or don't want to go and see a specialist about osteoporosis risk reduction. So the good thing now is there's online free to watch videos that will, as you're doing the exercises, resistance training, if you're doing squat stone, I'll say, make sure your back's straight. Keep your knees pointing straight ahead. So they'll be giving you cues to make sure the exercise is done in a way that's decreasing your risk of hurting yourself while you're doing it.
Final question for you, Jeff. If you could buy one piece of exercise equipment to get the most benefit, what would it be?
Probably a treadmill. So if you've got a treadmill, then that gives you the option of doing walking when you maybe don't want to go outside. Also, you can increase the speed to get higher intensity exercise out of it.
Mariam, your thoughts on Professor Coombes' advice?
Yeah, I love what he said, that it's not just cardio or it's not just strength training. It's both. And I think that's really important that people know. It's not just about lifting weights. It's not just about running. It's that combination. So we know that cardio keeps your heart and blood pressure in check, while that resistance training work builds that bone strength that mobility and that independence as you age, which is so important. The good news is you don't need a gym membership, and it's just a reminder for me to cancel my gym membership.
Have you not been attending,
I know,
Mariam?
it's so bad. I hate that. You just like, it happens to so many people. So think squats from your chair, wall push-ups, brisk walking between street poles, that's a thing. Simple moves that add up when you use them often. And if you've got joint issues or chronic conditions, chat with your GP. You might be eligible for a care plan and a referral to an exercise physiologist or a physiotherapist, and they can help tailor something safe and effective for you. Yeah.
Also, just be aware there's lots of videos in my feed right now which are like, these are the only exercises you'll ever need to do, or do these 5 exercises every day and you'll never have to do another thing as long as you live. That's just not feasible.
Yeah.
Like, your body needs different things for different reasons, and if you're just going to do those 5 things,
That's
do those
boring.
5 things.
It's a
It's
bit
fun
boring
to
as
start
well.
with, but yeah, it's boring as heck. But also, it's just not possible for those 5 simple things to
Exactly.
cover
Yeah.
everything that your body
Yeah.
needs. So just be aware that some advice you might be getting from your social media feed, I know, shocked by that statement, might not be completely accurate. It is quick consult time next. If you do want Dr. Mariam to answer something for you, or at least, set you on the right path to get that thing taken care of that you have been putting off for a while, shoot us an email, well@mamamia.com.au. You can slip into our Insta DMs too, or TikTok comment section. There's also the waiting room, which is an anonymous online form. So you can submit that. The link to that is in our show notes. Today it's for Carolyn, who is really not coping with her weight.
Quick question. Are you tired of the news? Do you want a podcast that isn't self-improvement? Come get unleashed. It's funny.
I also think that underwear is sort of almost like a new marriage. Like, it starts off, it gives you the best of what it offers at the beginning.
It's unhinged.
I have a bit of a thing for my friend's husband's salami.
Hello.
It's not here to teach you anything.
I need to make sure he looks at me. One side, I'm going to make a sign. This is what I married because I didn't meet you in time.
Yeah, right.
The other side, with pointing to my son who's 12. Look what we could have had, Lewis.
Yeah, I love it.
It's a good time for Gen X. So search Unleashed wherever you get your podcasts. New episodes every Tuesday.
Ready to do this, Dr. Mariam? Bring it on.
The doctor will see you now just through here to consult room 1.
Carolyn, thank you for waiting. How can I help you?
Caroline's really stressed, and I really felt this when I read this, and we decided to bring this to you, Dr. Mariam, because I felt this like deep in my bones.
Yeah.
So I'll tell you what she wrote.
I've been overweight my entire life, and not just a little bit. BMI-wise, I'm classed as obese, even when I was at my smallest. I've done every diet under the sun, and I was diagnosed with PCOS when I was about 24 and told to go on the pill and stay on it and then come back when I wanted to have a baby. I only stayed on it for 2 years, and I'm now 40, and nothing will help me get this weight off. I did lose about 10 kilos with weight loss injections, but it's costing me hundreds of dollars a month. I haven't lost anything further in about 6 months, but I'm terrified to stop taking it, as I know that the 10 kilos will come straight back on again. I barely eat anything, but I'm so scarred from dieting my whole life, I just can't fathom the idea of counting calories or macros or anything ever again. I think it's like some version of PTSD. I just don't even know what to do anymore.
She's describing someone that has lived her whole life with weight that's constantly being commented on, medicalised, and pushed through endless diets. No wonders why she's exhausted. Of course, the idea of tracking and counting again feels traumatic. That's not a lack of willpower, it's burnout from years of being told your worth was tied to a number. And you're right, with PCOS, weight loss can be particularly tough. It's not a level playing field. We know that hormonal and metabolic factors make the body more resistant to weight change, even when we have healthy habits. That's why the old advice of just eat less and move more, it's so unhelpful.
Oh my God, if I hear someone else say calories in, calories out one more time, I'm going to scream.
And we know with the newer weight loss medications can help, but the challenge, as you said, is the cost. And results can plateau. We also know that once you stop, the weight can come back. Because these medications work while they're in your system, they unfortunately don't reset metabolism permanently. So where does that leave you, Caroline? And I think The most important step here isn't another diet or the number on the scales. It's about rebuilding your relationship with your body and trust with your body. I think focusing now on health gains that aren't tied to weight, so improving sleep, strength, mental health, hormone balance, self-compassion, maybe getting a blood test to check that there aren't any underlying issues at play as well. And I think working with a GP experienced in PCOS can help navigate medications and referrals potentially to an endocrinologist. We spoke about having a team and how that's really important.
So important. It changed my life, Carolyn, to have those people on my side.
And I do think a dietitian who understands intuitive eating can help guide you back to a healthy relationship with food. And I do think at this point a psychologist or a counsellor can support your mental well-being, your body image, and help you manage the burnout that you're experiencing. Now, you've done decades of hard work. Maybe just for now the goal isn't more weight loss. Maybe it's finding a way to live in your body without constantly fighting it. Having these relationships with the, dietitian, exercise physiologist or psychologist or all the above, and then just kind of slowly navigating into that path of weight loss if that's something that you want.
Yeah, that's so beautiful to think, because I know what you said before about feeling judged according to your weight. And you're right, every doctor's probably told you every issue you've ever had is because you're overweight.
Yeah.
And you do start to feel, and I feel this goes hand in hand with getting older too, and Carolyn, you mentioned that you're now 40, but you feel more and more invisible the older you get if you are a little bit overweight, because you've been essentially slightly invisible for your whole life because you're told you're not thin enough to be visible. And that's really, it takes a real toll on your mental health over time, and it's hard not to hate yourself because it's like, why can't I do what everyone else does? Why can't I just not eat that? Why can't I not just be thin? It's a real head game. And so, Caroline, we totally see you, and we hope that Mariam's advice goes some way to at least letting yourself love yourself a little bit nicer from this point on.
You deserve it.
100%. Who cares what people think of us, even though we all struggle with that, mate. Thank you so much for listening to Well Today. If you could do us a little bit of a favour, rate and review us in your favourite podcast app. And I know you've probably heard us say it before, but it really helps. It
Love
helps
us.
Please.
Love us.
We're not needy at all, but love us, please. I know you probably get asked to do this all the time from whatever other various podcasts you are listening to. It does have a big impact on that stupid algorithm that we're all trying to figure out. And we know we're all fighting that thing. So if you have time, get in your Apple Pods or Spotify or wherever you listen and let us know what you think of the show. And Mariam and I will be your best friends forever. We promise.
Yeah, I have no friends, so...
That's not true. Also, prepare yourself. The weekly warning is incoming. The info you have heard here today is general, not specific for you. Make sure you take it, arm yourself, use it when you put questions to your own healthcare professional so you get the info that is right for you.
So next week we are going on a generational hormonal tour. Sounds like the worst music festival ever, right? And completely exhausting, but seriously, we're looking at what we need to know about our hormones from puberty to fertility through pregnancy and perimenopause, all the way to the postmenopausal years, every step of the way to make sure we're across what our bodies are up to, what can potentially go a little bit awry, what our bodies need and how to handle it through every transition.
So we'll catch you for your appointment next week.
Bye-bye.
Well is produced by me, Claire Murphy, and our senior producer, Sally Best, with audio production by Scott Stronach, video production by Julian Rosario, and social production by Ellie Moore.
Mamma Mia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wonnarua people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.